Hi everyone, I'm Dr. Stephanie Kamalia Reznick. I'm a board-certified internist and one of the medical directors for virtual primary care here at Oscar. In today's video, I'd like to talk a little bit more about the COVID-19 vaccine. It is currently the summer of 2021, and we've learned a lot about the vaccine. It's highly effective at preventing any hospitalization, deaths, serious illnesses, or even symptomatic illnesses from COVID-19. If you were to catch a breakthrough infection despite being fully vaccinated, and that's really rare, you're less likely to transmit the virus to anyone else around you. This is all great news. It's important to get the vaccine, not only to protect yourself, but to protect those around you as well. Some people haven't been able to get the vaccine yet, and some who have had the vaccine didn't amount enough of an immune response to be protected. The more people who get vaccinated, the faster we can get to herd immunity and put this pandemic behind us. If you've already been vaccinated, thank you. Per the CDC, you can now pretty much live life as if you did before the pandemic even happened. So that's great. If you haven't been vaccinated yet, but you're interested, I'd like to tell you a little bit about what to expect. You'll have to make an appointment, likely at the local pharmacy or your doctor's office. Make sure to come in masked, as you're not fully vaccinated yet by definition, and you should be masked. Additionally, as a side note on masks, masks are recommended for everyone, vaccinated or not, in a healthcare setting, at least at this time. When you go to your appointment to get your vaccine, remember to bring your insurance card and a form of ID as well. If you have any health information, such as severe allergies, bring that as well. If you normally carry an EpiPen, it's important to carry an EpiPen with you everywhere, and this is definitely no exception. After you get the vaccine, you'll have to sit down and wait for about 15 minutes, 30 minutes if you have a history of severe allergies to certain ingredients, to make sure you're doing okay. Now, some people ask if they should take medication before getting the vaccine to prevent side effects. The answer is no. Not only is this not likely to be very effective, it may actually decrease the efficacy of the vaccine. If you develop side effects after you receive the vaccine, make sure to reach out to your doctor or other healthcare professional for next steps. That said, for a sore arm, a nice cold compress can really help. Now, a few words about the timing of the vaccine. You're considered fully vaccinated and protected as you're going to be based on the vaccine 2 weeks after you've received the final dose. If you're getting the Pfizer or Moderna vaccine, a second dose will be necessary. It is recommended that you take that second dose in the same timing interval as it was done in the trials. That said, it's not always possible, and the CDC says not to worry if you have to receive the second dose up to 42 days after the first dose. That said, even if you can't get the second dose in that time frame, the CDC says that there is no need to restart the series. One thing to keep in mind when you're making your appointment is that you cannot receive any other vaccines within 2 weeks of receiving the COVID-19 vaccine. So, if you're due for another shot, like a tetanus booster, keep that in mind and plan accordingly. If you're a patient of Oscar's virtual primary care, please don't hesitate to reach out if you have any questions or concerns. If you're an Oscar member but not a patient of the virtual primary care team, don't forget that you still have the virtual urgent care available to you 24/7. For non-clinical questions, like questions about cost or coverage, please don't hesitate to reach out to the concierge team. You can call them at the phone number on the back of your insurance card. I hope this information was helpful, and I'll see you next time.